And I'll read what the director of the World Health said this morning. Pandemic is not a word to use lightly or carelessly, the director said. It is a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and even death. The World Health Organization considers a pandemic the worldwide spread of a new disease for which most people do not have immunity. Secondly, Centers for Disease Control and Prevention said pandemic diseases are new global viruses able to easily infect people and spread from person to person. And that's why they classify it as a pandemic situation. It is new and it is worldwide. And at this time, because of its newness, we don't have a vaccine. So all the actions we're going to take is try to minimize, as the chief so well said, especially of fear, has to be based, as you said, on good information. And we know that credible and good and timely information is one of the greatest elements of battling fear. And we must do a better job on that. In regards to what happened, of that, the parks people immediately going out there and spraying, and that's my fault, the responsibility on the timing of that and the lack of notifying people. We were notified in the afternoon of the possibility of affected people visiting our shores of the east side, finding out different places they commonly go. Immediately, public workers said, do what you can as fast as you can, even though it's pahan almost, to go out there and do some disinfecting. How effective it will be, nobody knows, and I don't care. Just do what you can. And from now on, when we do things like that, I'll make sure that on SOP it is notification. I shouldn't, I will not expand on it, but I think people know of my impatience with the state and federal government. Mm-hmm. I've said it openly, especially on the testing. And your examples of the time is, really bothersome that we had to rely on a plane carrying a sample there and a plane, result back. And the first kit that came here was broken or not functioning right, so you got to send them back. And, that is so ridiculous to me in this day and age. And then finally, yesterday or today, the private labs are going to be given the equipment and training to do it. To me, it should have been done 2 months ago or whatever. It's all that easy for me because I'm Monday night quarterbacking. But on your direct question of how much, I do everything I can do until somebody tells me it's not my authority. I'll make it clear here. During all emergency, normalcy stops. And some of it predictable, others are not. Shortage of revenue is an automatic thing. Adjustment that we may have to come forth to you and anybody else or departmental is going to be automatically done and must be done. The DBEDT already has estimated in regards to possible shortage on minor kind of flow stops. So I'm just notifying you that yes, our total budget will be adjusted. Right now we're planning as is, and then we'll see what changes have to be made, and they will be made. I learned a lot of sacrifice, for example, like Italy. I really admire some leaders today. Can you imagine being in charge of a country and quarantine that country from the rest of the world? Italy depends heavily on tourism also. But we almost put lives and survival and normalcy of that element as number one, bar none. And I ask you to trust that we will do that, constantly weighing what must be expanded or cut or whatever. We will do everything we can and think of and communicate with you better and everything else in regards to have this community ride it through. I kind of like to emphasize this though, because I think the tone of everything is so negative that I've added to anxiety or fear more than I should have. The good news about this virus is the following. It is estimated at this time that this is a new virus, obviously. Number two, 80% or more of the people that get affected by this virus will survive this virus and not even know they had the virus, because their symptoms will be minor in regards to sniffles and light cough and those kind of things, low fever. It is known at this time that the majority of the severely affected is that their system, not the immune system, but their system as a whole is weak anyway because of age and other health conditions. My son called me up because my granddaughter heard that 80-year-olds are the most greatly affected. And she says, it's Grandpa. That's Grandpa. And I know that. And I hope the 80-year-olds don't misunderstand what I'm saying. I think we all 80-year-olds are glad it's 80-year-olds and not the 2-year-olds.
Yeah.
So the good part about it is that the vast majority of those who carry the virus will not even know they had it unless they are tested for it. Follow up on it. But I want to follow up on the questions of the cruise ships as an example of things that must be weighed. As yesterday I met with the captain and owners of Pride of America and told them that, I realized the extreme importance of many people on the economy impact of the ship. If it was as simple as that, closure, and not considering all the other consequences of any action, life would be so simple. The question that we asked of the Norwegian Cruise Line yesterday is identify those things that they have been doing to minimize any risk. And I was really impressed. They changed their whole buffet line system of the people not touching the service thing or whatever, that every passenger going off are not asked to spray, they spray, those kind of things. If the cruise line was guilty of already, I think recommendation would have been to re-examine until further notice. What will be our recommendation eventually of everything, I don't know, especially when we talked about difficulties like the Monarch. But I want you all to imagine that we had airlines guilty of transporting people who had the disease at advanced stage. I cannot react by saying all flights should be canceled, because I know the pure economic impact of so many thousands of people, even if it was my authority. Whether it's my authority or not, I am obligated to look at all the factors of decision making. We have a thing here that I'm going to follow up. We already followed up before this meeting of a doctor. He said Hawaii, young 30s, came to Hawaii. I don't know where. I asked, where Hawaii? And that's being followed up on. Then he went back to Canada and he has the virus. Naturally, Department of Health and everybody got to work backwards. But I need all of us to understand, because we get nasty calls or letters or why aren't you doing this, why aren't you doing that? And you don't know how much I appreciate your comments, sir. And it's not that simple. The confidence I need is that people should know we are reviewing everything we need to make the good, timely, right decisions. whether it be on cruise ships, flights, hotels, beaches, or whatever, all cleaner.
You brought up is the resupplying. So we've had back orders on supplies for weeks now. We put in orders from the beginning when we were in tune with what's going on and kind of like the theme of staying proactive. However, because it's a worldwide issue, an international issue, it is something that we have on our radar. So we're monitoring our levels of PPE. We're monitoring the vendors and the turnaround time. In regards specifically to N95, we have a good stock of N95s with our department. The mayor has just informed me he has some supplies as well. So N95 wise, I think we're in a good position. It's the other PPEs like the gowns that every first responder, every healthcare provider is battling to get, so to speak.